everyone, my name is Junon Macéus. I'm an advanced meditator with more than 10,000 hours of meditation practice and the author of the books Truth and Empathy, How to Find Your Soulmate, as well as Theta-Waves Meditation. And I'll put a link to my books below. This video is about why most people are vulnerable to COVID-19. The pandemic has been challenging for the majority of people because they face financial difficulties. Some have lost their job, their businesses. We had to keep a distance from people we care about. It was only through Zoom or through phone calls that we were able to stay in communication. Also, we were not able to gather with other people who were close to our residents. So there was the social isolation that really added to the sense of feeling disconnected. But also the other intriguing aspect has to do with how many people who were relatively young, I'm talking people in their 20s, 30s, 50s, who caught the COVID-19, and not once, but maybe 2 or 3 times. And I know cases of the sort. So in other words, you have to ask yourself why is so. And the main issue has to do with the fact that most people are mouth breathers. And if a person is a mouth breather, they're more likely to be affected by any airborne pathogen, which was the case with COVID-19. So a person who's a nose breather breathes less air that is sanitized, pressurized, humidified, and basically conditioned in a way that when it is inhaled, there is better gas exchange. And what happens also in the nose, there's production of nitric oxide. And this molecule basically kills pathogen that is in the air. And since most people are mouth breathers, they don't get this advantage. So it's not by accident that so many people during the pandemic had to, even when they were wearing masks or kept 2 meters distance, they washed their hands, all trying to follow all the instructions, still caught COVID-19. And the other important aspect is that if a person's a mouth breather, it expels too much carbon dioxide, and carbon dioxide is the cue that lets the red blood cell know to deliver more oxygen to the tissue. So in other words, the person is not properly oxygenated. If you look at the cells, is that the organelles that produce energy are the mitochondria. The mitochondria needs oxygen and nutrients to produce this energy. But oxygen is more important than nutrients because we can live a few days without water, a few weeks, even a few months without food, but we can only survive a few minutes without oxygen. So it's very important to make sure that we're getting proper oxygenation through the nose. So what I've done is created meditation videos with a theta brainwave frequency embedded in them. So people watch these videos, their brainwaves automatically slow down and their resting breathing rates follow suit. So they're more likely to breathe through the nose versus to the mouth. And I would invite you to register for my pre-recorded online course titled Meditation and Health, because in this course we discuss the importance of proper breathing and nutrition for optimal health, and also you get access to those meditation videos. So I'm going to put below a link to this course. It's $150 per person. You can do it within 2 weeks, but you have a month to actually complete it. This course will give you the tools to better take care of your health in general, so you're less vulnerable to a number of pathogens that are in our environment. Nose breathers breathe less air that has been sanitized, humidified, pressurized, so that when it gets into the body, there's better gas exchange and less chance of being infected. And the other important aspect is the fact that we produce a lot more nitric oxide through the nose, so it is an antimicrobial agent, so that again the air that we breathe in is well conditioned for the body. So again, I would suggest to register for my course. I'm going to put the link below, because this course will really take you through a journey that shows you how to meditate properly so that you can correct your resting breathing through those meditation videos, and know how to have a proper diet so that you can maximize your health and be less vulnerable to a number of microbes and viruses in the environment. And the COVID-19 pandemic really shows how people were real vulnerable, because we're looking at people who are rather young, looking at like maybe they were in their 30s, 40s, and they were end up in the ICU, and many of them died. So all this to say is that it's not normal to see that level of vulnerability in the population. It has to do with the fact that, again, they're mouth breathers instead of being nose breathers. So let me know what you think about the content of this video by commenting below. If you like this video, if you learned something, please click on the like button. Also remember to click on the notification bell to be notified of other videos I'm going to be making. Subscribe to my channel, and we will talk soon. Hi everyone, my name is Junon Macéus, and welcome to Meditation and Health. It is a Theta-Waves Meditation course. The entire course will be about an hour long, and the first part will focus on breathing and the second part on nutrition and their relationship to mental health. So the first week we will have the course outline, then we will explore breathing anatomy and physiology, then go to mitochondria and cell oxygenation, then explore nasal breathing and how it's linked to jaw development, and we will finish with resting breathing rate and overall health, as well as the impact of meditation on mental health. The second week will be about real food versus ultra-processed food. Then we'll explore the nervous system degree of food processing, then move on to mitochondria and cell nourishment. Then we will explore the impact of nutrition on mental health. Then we will finish with some nutrition guidelines and book recommendations. The goal of this meditation course is for you to gain as much practical, effective information in the shortest period of time. So how the course is scheduled is that I would recommend for you to do a 20-minute meditation followed by 30 minutes of the theory. So students will have access to the Theta-Waves meditation videos for about a month. So the way these meditation videos are designed is that they have a theta brainwave frequency embedded. And so when people watch these videos, their brainwaves automatically slow down so you can experience a deep meditative state on your first attempt. So the total time commitment is 2 weeks, so times an hour, so a total of 2 hours, and the entire course is pre-recorded and needs to be completed within a month. The reason being is that most people, when they don't have a deadline, they just drag this on. So in other words, if you want to reach your goal of improving your overall health and most specifically your mental health, you need to have a deadline so that people can actually finish it on time. The course content is so there's one class about 30 minutes on the impact of breathing on mental health, and there's a second class again about 30 minutes on the impact of nutrition on mental health. Then you will receive class notes by email so that you don't have to write everything down. So in other words, you can focus on the course and you know that the major concepts that you need to retain will be emailed to you. I recommend that you watch short videos before each class because it will give you some visuals, audio, and it will make you more familiar with the unusual ideas and concepts that are going to be presented in this course. And the list of these videos are going to be included in the class notes. And also, if you can measure your vital signs before and after meditating, because it will give you some objective data to determine when you're calm versus when you're stressed. You might be wondering, who is your meditation teacher? My name is Junon Macéus. I have a nutrition and human kinetics background. I've completed a dental assistant certificate as well as a postgraduate certificate in clinical trial research. I've authored 3 books. One of them is titled Theta-Waves Meditation. I'm an advanced meditator with more than 10,000 hours of meditation practice, and I've created the Theta-Waves meditation technique. I've worked as a health coach, health educator, and recently I've taught the Theta-Waves meditation course over a period of 3 months to the Black mental health Canada clients. And based on that, I decided to create a shorter version of that course. Now, I got some testimonials from some of my students. For example, Kim Okoma, she said that this experience has been amazing. I learned so much. The content was wonderful. Thank you for the time and commitment you put into the weekly presentations and this group. There's another lady, one of my students, again, she said something really positive. Her name is Emily Andre Jabouin, and she said that as a dance artist and someone who has been suffering from anxiety for a long period of time, this course was such a gift. The simple lesson of making sure that I always breathe through the nose is life-changing. And actually, I've been teaching this meditation technique for more than 2 years, but I decided again the past 3 months to really create a course, and now I'm creating this pre-recorded course so that it's more people can have the opportunity to learn these concepts.